Hello everyone, this video will help you to learn about COVID-19 during pregnancy. I am S. Kezia, working as a tutor in Triple M College of Nursing. The objectives of the video, we are going to learn the introduction of the COVID-19, the symptoms, are the pregnant women an at-risk group, and antenatal care and clinical management of COVID-19. What is vertical transmission and what are the risks of the newborn, care during pregnancy and birth, breastfeeding and COVID-19, home isolation guides for the mother who's affected with COVID-19, minimize the spread of COVID-19 at the healthcare facilities, donning and doffing, the 5 steps to prevent COVID-19. So these are the topics we are going to learn in this video. First, the introduction. COVID-19 is an illness that affects the lungs and breathing. It is caused by coronavirus. The symptoms may include fever, cough, sore throat, and congestion. Other symptoms are possible too. And symptoms may appear 2 to 14 days after you were exposed to the virus. You may have no symptoms, mild symptoms, or severe symptoms. The symptoms may vary with COVID-19 variants. Okay, we are getting so many kinds of variants these days. So the symptoms, whether you have a mild symptoms, no symptoms, depends on what variants you are affected with. And also it may vary based on the vaccination status. If you are vaccinated, the symptoms will be no symptoms to mild. Okay, otherwise it can be a severe symptom also. So it is basically a respiratory disease, and most infected people will develop mild to moderate symptoms and recover without requiring special treatment. So this is about the introduction of the COVID-19. Next we'll see about the symptoms. Symptoms from exposure to COVID-19 to the moment when the symptoms begin is on average 5 to 6 days and can range from 1 to 14 days. The common symptoms of COVID-19 include fever, tiredness, and dry cough. The other symptoms are sore throat, difficulty in breathing or shortness of breath, aches and pains. Diarrhea, nausea, a running nose, and recent loss of taste or smell also can occur. Okay, so these are the other symptoms of the COVID-19. Basically, the main symptoms include fever, tiredness, and dry cough. So next is, are the pregnant women an at-risk group? Pregnant women or recently pregnant women, it means they may be in the postnatal period, okay, who are older and overweight or having pre-existing medical conditions such as hypertension and diabetes seem to have an increased risk of developing severe COVID-19. So why is this? Okay, why they are at risk of developing increased risk of developing severe COVID-19 is that when pregnant women develop severe disease, they also seem to more often require care in intensive care unit than the non-pregnant women of reproductive age group. This is because of their change in their bodies and immune system. So we know that the pregnant women can be badly affected by some respiratory infections. So that's because of the change in their hormones, okay, change in their bodies and their immune system. These pregnant women are severely affected by the respiratory infections. So it is therefore important that they take the precautions to protect themselves against the COVID-19 and report the possible symptoms including fever, cough, and difficulty in breathing to the healthcare provider. Okay. So the next topic is antenatal care and clinical management of COVID-19. So in this antenatal care, we are categorizing the care into 3 categories, mainly mild state, moderately affected, or severely affected. Okay, so the pregnant women can be have mild symptoms or moderate symptoms or severe. They may having the severe symptoms. So if they are having mild symptoms like flu symptoms like anosmia and myalgia, so if they are having these and also if they are in first and second trimester, the treatment will be home isolation, symptomatic managements, antipyretics and hydration, and consultation with the obstetrician for the health, monitoring the health of the fetus, and physician for the monitoring the progress of the COVID-19 illness. And Review visit after 2 weeks, sonographic assessment of the fetal anatomy and growth as appropriate. So you have to do the USG scan also. And if the mother is in mild symptoms and in the third trimester, the treatment will be like because the fetus is beyond the period of viability, so fetus is safe. Mostly home isolation is enough for the mother. Decision for delivery should be individualized. So individualized means based on the patient condition. Okay, so and also based on the obstetric indication and need. So the decision for whether it is a normal vaginal delivery or a cesarean section, the obstetrician will decide based on the obstetric condition as well as the individualized patient need. This is about the mild condition, management of the antenatal woman with the mild symptoms. Okay, next is the about the moderate. So in moderate category of antenatal women with COVID-19 illness, the woman will be having dyspnea, refractory fever. It means the fever comes and goes often again and again, on and off, and pneumonia and abnormal blood gas. Okay, so these are the criteria for moderate illness with COVID-19. So in this case, you have to admit the mother in the ward and investigate complete blood count, kidney function test, C-reactive protein, erythrocyte sedimentation rate, and also you have to mainly monitor the procalcitonin, IL-6, LDH, ferritin, and D-dimer every 48 to 72 hours. So these are the things to be monitored for the woman who's admitted. Okay, and also look for the danger signs like shortness of breath, tachypnea, oxygen saturation less than 94%, and persistent fever beyond 5 to 7 days, inability to tolerate oral fluids, confusion and lethargy. So if these danger signs, if you come across, then you have to see whether the woman is in first or second trimester. If the woman is in first or second trimester with these danger signs, then you have to manage the pregnancy. You have to try to continue the pregnancy by administering steroids, anticoagulation, and antibiotics if needed, because this antibiotics can sometimes cross the placental barrier and it can affect the fetus. So if needed, only antibiotics can be given. Otherwise, we have to manage to continue the pregnancy with the steroids and anticoagulants. If the woman is in third trimester with this danger signs, then we have to take the decision for the delivery. Okay, so because the baby is beyond the period of viability, and a decision for delivery should be made based on the obstetric indication or the worsening maternal condition. So this is about the treatment for the antenatal woman with moderate illness of COVID-19. Okay, next is about the severe illness. So in severe condition, when we say the mother is in severe condition, is that the respiratory rate is greater than 30 per minute and the oxygen saturation is greater than 94%. So in this case, they say that that is the Society for Maternal Fetal Medicine. They say that the following treatment has to be given. That is, admit the patient in HDU or ICU, investigate complete blood count, kidney function test, C-reactive protein and ESR, procalcitonin, IL-6, it means the interleukin 6, and lactate dehydrogenase, ferritin, D-dimer every 48 to 72 hours. So these procalcitonin, IL-6, the LDH, ferritin, D-dimer are the markers of to say whether the prognosis, whether it is bad prognosis, and the mortality, okay, the severity of the mortality or estimated by this main critical test. Okay, those are the IL-6 and LDH values. Okay, so that's why they monitor these values every 48 to 72 hours, and also provide oxygen saturation and non-invasive ventilation or mechanical ventilation, steroids, anticoagulants, antibiotics for community acquired pneumonia, and also if the baby is beyond 32 weeks, the decision for delivery is to be considered for refractory hypoxemia. Okay, it means if the oxygen saturation is keep on getting low, we have to consider for delivery. Okay, this is about the categories of antenatal treatment. Okay, antenatal care and clinical management for various severity of the illness, for mild, moderate, and severe. According to the trimester wise, we saw the treatment. Okay. Next is about the vertical transmission and newborn risk. So this COVID-19 is a new disease that is coming these days. So there is no particular, enough research evidence to say that the pregnant woman with COVID-19 can pass the virus to her fetus or baby during the pregnancy or delivery. So till date, the virus has not been found in the samples of amniotic fluid or breast milk for a mother who is affected with COVID-19. So based on the limited case reports, the adverse infant outcomes, it means example, if the mother gives birth to a preterm baby, then the baby is said to have affected with COVID-19. But it is also not clear if these outcomes were related to maternal infection or the baby got it from the environment. We don't know. And the risk of adverse infant outcome is not known. Okay. So if the infants born to the mothers with a positive with COVID-19 during pregnancy are considered an at-risk group. Okay, so yeah, whichever the infant is born to a mother who is affected with COVID-19, these infants are considered as an at-risk group, and these infants should be monitored closely for danger signs. Even though the transmission after birth via contact with the infectious secretion is a concern. It means infectious secretion means we mean the breast milk. Okay, so after birth via infectious secretions, these transmission can occur. It is not recommended to separate the mother from the newborn. Okay, so even though the breast milk can pass the virus, but we do not have the evidence to support it at present, but still it is recommended not to separate the mother from the newborn, and the risk of exposure should however be reduced. So how we reduce is that close contact and early exclusive breastfeeding help a baby to thrive. So what they say at last is that the mother should be supported to breastfeed safely with good respiratory hygiene. Okay, hold the baby skin to skin, share a room with her baby, and a woman with confirmed or suspected COVID-19 should use a face mask and practice the hand hygiene before each feeding or other close contact with her newborn. Consider limiting the visitors except for healthy parent or caregiver. Visitors should be instructed to wear appropriate personal protective equipments like gowns, gloves, face mask, and eye protection. So at last what we say is that breastfeeding should be given to the mother, and the mother should be supported to give breastfeed safely to her newborn. How she gives safely is that by following the good respiratory hygiene. Okay, skin contact is essential, and also limit the visitors, and if the visitors is coming to see the baby, they have to wear the personal protective equipments. Okay, this is about the vertical transmission and the newborn risk. Okay, that is continued in this slide also. The next is about care during pregnancy and birth. So all pregnant women, including those with confirmed or suspected COVID-19 infections, have the right to have high quality of care before, during, and after childbirth. This includes antenatal, newborn, postnatal, intrapartum, and mental health care. If COVID-19 is suspected or confirmed, healthcare workers should take all appropriate precautions. Okay, so if there is a woman coming to the PHC with the confirmed or suspected COVID-19, what we should do is that you should take all the appropriate precautions to reduce the risk of infection to yourself and to others, including hand hygiene, appropriate use of protective clothing like gloves, gown, eye protection, and medical mask. And healthcare workers should promptly notify the infection control personnel at their facilities of the anticipated arrival of a pregnant patient who is confirmed with COVID-19 or is a person under investigation. So if possible, the patient with the known or suspected COVID-19, so they should be cared for in a single person room with door closed. Okay, so if the mother is having confirmed or suspected COVID-19, they should be given a single room with the door closed. Okay, mode of delivery according to WHO, GOI and ICMR advises that the cesarean section should only be performed when medically justified. The mode of birth should be individualized and based on a woman's preferences along with the obstetric indication. One birth companion can be present throughout the delivery with confirmed RT-PCR negative report. The birth companion should also instructed to be wear the appropriate personal protective equipments including gown, gloves, face mask and eye protection. So this is about the mode of delivery. Okay, next is the breastfeeding and the COVID-19. Women with COVID-19 can breastfeed if they wish to do so. A woman with COVID-19 and her baby should not be separated. So as I told you earlier, the woman with COVID-19 infection and the infant, they should not be separated. They should always, the woman should give the breastfeed in order to make the baby to thrive and also follow the the respiratory hygiene. Okay, follow the respiratory hygiene and she can give the breastfeeding. The following precautions should be taken by the mother when breastfeeding, that is practice respiratory hygiene during feeding, wearing a surgical mask where available, and perform hand hygiene before and after breastfeeding, skin to skin contact or routine care, and routinely clean and disinfect surfaces they have touched. And so these are the breastfeeding guidelines, okay, during the woman affected with the COVID-19. Next is about the home isolation guidelines. What we should say if the mother is discharged with the COVID-19 infection, the instruction to the patients are: what is the under the place of stay, isolate in well ventilated room with cross ventilation, do not share personal items with other people in the household, ensure cleaning of the surfaces in the room that are touched often, and we should clean it with the 1% sodium hypochlorite, and under the respiratory hand hygiene. So that's about the place of stay. Next is about the respiratory and hand hygiene. What you will instruct is that use a triple layer medical mask, discard the mask after 8 hours of use or earlier. If they become wet, disinfecting it with 1% sodium hypochlorite, and respiratory etiquette is always should be followed, and frequent hand washing with soap and water for at least 40 seconds, or clean with the alcohol based sanitizer. Take rest and drink a lot of fluids to maintain adequate hydration. So this is about the respiratory and the hand hygiene. Okay, next is instruction to the healthcare providers or the healthcare provider. So what you have to how you should be when you are giving care to the mother with who is infected with COVID-19. So that is as follows: wear a triple layer medical mask. N95 mask may be considered when in the same room. So if you are in the same room, you have to wear a N95 mask. Front portion of the mask should not be touched during use. Discard the mask after use and perform hand hygiene after disposal of the mask. Use disposable gloves while handling the patient. Perform hand hygiene before and after removing the gloves. Food must be provided to the patient in his or her room. Utensils and dishes should be used by the patient should be cleaned and with soap and detergent or water, wearing gloves, and utensils and the dishes may be reused. Okay, this is about the instruction to the healthcare providers. Okay, self-monitoring at home. What all monitoring should be done? Monitoring chart, that is the vitals chart, and days of symptoms and time every 4 hours. What are the symptoms the mother is having? That should be recorded every 4 hours. That is temperature, heart rate, okay, and pulse oximeter, and feeling whether she is having better, same or worse feeling, and breathing is also better, same or worse. So under these 3 categories you can record the self monitoring at home that should be done for every 4 hours. Next is treatment for patient with mild asymptomatic disease in home isolation. So these are the patients who never come for the who won't come for the PHC because the symptoms are mild and it can be managed in the home itself. Warm water goggles or take steam inhalation twice a day. If fever not controlled with the maximum dose of tablet paracetamol 650 milligrams 4 times a day, then consider other drugs like NSAIDs. Example, naproxen 250 milligrams twice a day. Next is prone positioning. Prone positioning feasible in pregnant as well as postpartum patient. Okay, and including the recently delivered. Padding or supporting devices can be used. Example, pillows, padding from the operation room, and etc. May need to be utilized. Passive prone positioning can be done. Patient if the is not intubated, okay, and position herself in either the lateral decubitus position, typically for less than 2 hours in each position, or fully prone position may aid in patient comfort. Okay, so if these can be followed, it will help avoid intubation. Okay, so this is about the treatment for patient with a mild and asymptomatic disease in home isolation. So next is about how long this home management, okay, home isolation guidelines can be followed is that. Okay, so continue that with mother who is tested positive is that if the mother is, okay, asymptomatic, okay, here the picture is that the mother is in home and she is tested positive and she is asymptomatic. Up to 10 days these procedures can be followed, the routine screening. Up to 10 days the above mentioned, okay, treatment can be followed, and after testing positive, okay, and if the mother is symptomatic, okay, then the at least 10 days have passed since the first appeared, okay, symptoms has first appeared, and up to 20 days if they have more severe or critical illness or severely immunocompromised. Okay, so basically means that after appearing of this, after regression of the symptom, okay, after regression of the last symptom, the at least 10 days have to be passed, then only you can stop the treatment, that is the home isolation treatment. Or if the mother having severe or critical illness, we have to wait for 20 days after the regression of the last symptom, okay, then only we can say the mother is safe at home and she can stop the home isolation guidelines at that time, and at least 3 days have passed since the last fever without the use of antibiotics. So if the criteria are met and the symptoms have been improved, then she can stop the home isolation guidelines when she is in the home. So if the mother is in home and following all these guidelines and the treatment, what are the criterias, okay, to be admitted in the ICU? Okay, so that's the about the next slide. What are the criteria? So she has to come to the hospital. If the mother is inability to maintain the oxygen saturation more than 95% with supplemental oxygen and rapidly escalating supplemental oxygen need, and hypotension, that is mean arterial pressure is less than 65 millimeters of mercury despite fluid resuscitation, evidence of a new end organ dysfunction, example altered mental status, renal insufficiency, hepatic insufficiency, cardiac dysfunction, all these indications will we have to take the mother to the ICU. And when should the COVID positive mother be discharged? Is that the decision should be based on need for monitoring and hospital care and availability of the home isolation facilities. For asymptomatic patients, 24 to 48 hours after a normal vaginal delivery, day 3 or 4 of cesarean section. That is the normal days. Okay, followed for a normal in case of a normal vaginal delivery, she can be discharged after second day, okay, if the patient is asymptomatic, and also if the patient is cesarean and she is asymptomatic, she can be discharged after fourth day, okay, after the admission. So this is these are the decisions should be taken And also the decision is based on the amount of monitoring required for the patient and hospital care and availability of the home isolation facilities also. Okay. So this is about the treatment of the woman who's affected with the pregnant mother who's affected with the COVID-19, whether she is in hospital or in home. Okay, the guidelines should be followed in home. Okay, that we saw till now. And next is about the donning and doffing, how to reduce the spread of COVID-19 in the healthcare facilities. All these things we are going to see now. First is donning and doffing. First is donning preparation, that means how to wear the personal protective equipments. Donning means to wear personal protective equipments. It must be done outside the infectious ward in a specific donning designated area. I think you all know what is donning and doffing. I'm just going to give a quick review. Okay, and healthcare workers must be prepared to take a meal using a washroom and water drinking before entering the donning areas. Remove all the jewelries, watches, mobile phones, etc., and wear hospital scrub and washable footwear. Perform hand hygiene, wear cap, wear shoe cover, wear the first pair of gloves, wear the gown. Look for any damage including tears and dirt. And wear an N95 mask, wear low strap, then the upper strap, and make a proper seal for the air. And wear eye goggle, wear hood with strap crossing over each other. And if the face shield is available, wear after wearing the hood. And wear second pair of gloves. How long can you wear the PPE? Is that surgical mask can be worn for 4 to 6 hours, N95 respirator 6 to 8 hours. Cover all hazmat suits and all the hazmat suits, that is the suits that is personal protective, is 6 to 8 hours. Any contamination or compromise should be discarded immediately. Next is, this is about the donning. Next is doffing. Doffing means taking off the PPE. If this should be done in a specific area, and check for any leaks before doffing, and perform hand hygiene every step. Follow biomedical waste rules management for discarding personal protective equipments. Clean any contamination on the gown. Use alcohol based wipes. So next is disinfect your outer glove, discard the shoe cover, disinfect your gloves and remove your glove from one hand then from the other, making single bag of gloves. Remove hood first, disinfect inner gloves, remove gown, remove eye goggle, do not touch outer surface, disinfect your gloves, remove inner pair of gloves as previously shown, and perform hand hygiene and wear new gloves before removing mask. Remove N95 mask. Do not touch the exposed surface of mask. Lower strap, then the upper strap. Disinfect the gloves. Disinfect outer surface of shoes with alcohol wipes. Disinfect your gloves again and remove your gloves to discard, and perform hand hygiene. Exit the doffing area and take the shower. Note: the donning exit area and doffing entry area should be separate. So this is about the donning and doffing. Next we'll see the 5 steps to prevent the COVID-19. Main thing are hands, elbows, face, distance and feel. These are the things you have to remember to prevent. Okay, to remember to 5 steps to prevent the COVID-19. First is hands. Perform hand hygiene frequently. Elbow, cover your nose and mouth with a bent elbow or tissue when sneezing or coughing. These are called the respiratory etiquette. Face, avoid touching your eyes, nose and mouth with unclean hands. Distance, stay at least 1 meter distance from each other. Avoid physical contact. Example, shaking hands, hugging or kissing. Feel, if you feel unwell and you have to stay at home. Alcohol based hand rub is the fastest and most effective hand hygiene method and better tolerated by your skin than the hand wash. So this is about the 5 steps to prevent COVID-19. So I hope you gained some knowledge about the COVID-19. Okay, so the what are the objectives, okay, and introduction of the COVID-19, the symptoms of the COVID-19, or pregnant women at risk group, and vertical transmission of the newborn risk, care during pregnancy and birth, and antenatal care and clinical management for COVID-19, and breastfeeding and COVID-19, and home isolation guides for a woman with COVID-19, and when she should come to ICU, and when the mother can be discharged. And we also saw about the donning and doffing, and main 5 steps to prevent COVID-19 among healthcare facilities. So these are the things we saw in this video. I hope you got some knowledge about COVID-19 during pregnancy. We'll see in the next video. Thank you all.